established CAPRISA back in 2001 to address why are young women getting infected and how do we change that and how do we stop patients with TB and HIV from dying.
We have miles to go and realize the UN 2030 goals of 0 new infections, 0 deaths, and 0 stigma and discrimination.
We did one of the first ever community-based surveys of HIV in Africa.
When we look at the numbers and we look at who's getting infected, it was happening more in areas and populations that have limited access.
Women bear about 4 times more infection compared to men. Not only that, but they acquire HIV infection 5 to 7 years earlier than men.
Until and unless we can stop infections in young women 15 to 24, we will not be able to realize the goals of an AIDS-free generation, the end of AIDS, or even attaining epidemic control.
All of us sitting here, we are against ignorance. We are against racial discrimination. We are against gender discrimination. And we are against all of those things that rob us of our human rights, our dignity, and justice.
One word comes to mind, which captures how together we've been able to achieve as much as we have, and that word is Ubuntu. Ubuntu is really the essence of being a human being, and how together we face challenges, but together work towards solutions.
After we got married, we had made a decision that we were both going to come to New York to study together. We both realized we wanted to work on HIV.
Had a very common vision even then, using health to improve our communities.
What's unique about Slim and CAPRISA is that they are completely connected to people on the ground, to the communities. They know what's going on, they know what's possible, they work with local people, and at the same time, they know everything about the latest, what science offers and what technology offers, to find practical solutions that will benefit the people in the community.
Had we not married and we launched HIV research careers independently of each other, I don't think we would have had half the discoveries that we have had in the last 8 years.
Another way of looking at this is a 39% lower incidence rate in the tenofovir gel group.
CAPRISA, under the leadership of Slim and CAPRISA, have critically looked at problems in HIV and TB that affect South Africans and have engineered and designed research that answers questions that not only help South Africans but help policy at an international level.
We pioneered work to show how by co-treating HIV and TB, you can reduce death by 56%.
CAPRISA and I, our role is to encourage, support, facilitate. But the actual hard work that makes the research really great comes from the wonderful people we work with.
CAPRISA is very unique in that I've worked with many other organizations. I was very happy that they were ready to engage with the community.
CAPRISA is uniquely placed because we are in the hyper-endemic hotspots in South Africa.
And we chose to look at exposure, vulnerability, and what are things that may be impacting on HIV prevention technologies.
Our work as scientists is to try and find technologies that women can use to prevent HIV infection, with especially those women who are unable to negotiate the traditional safer sex practices. By saving women's lives and preventing HIV infection in women, we have the potential of altering the epidemic in many settings and saving many millions of lives.
We have to set up the standards of excellence and lay the foundation for the next generation of scientists. We are people who are trying to make a difference.
We are both passionate about the fight for democracy and the belief in human rights. I dream of a world without AIDS. Here at CAPRISA, CAPRISA and I are focused on that problem.